Hello there. Welcome to another Google Hangout. My name is Colin Cairns from the Baker College of Auburn Hills Learning Center. Today I'll be covering Chapter 5, 6, 7, and 8 for the Test 3 review. And in a moment I will pull up a PowerPoint for Chapter 5 and we'll get started. Introduction to Chapter 5. We're talking about tissues in Chapter 5. Similar cells with a common function are called tissues. The study of tissues is histology. There are four primary types of tissue: epithelial, connective, muscle, and nervous. Tissues are joined together by intercellular junctions. Tight junctions are close space between cells. They're located among cells that form linings. Desmosomes form spot wells between the cells. They're located among outer skin cells. And gap junctions are tubular channels between the cells. They're located in cardiac muscle cells. The general characteristics of epithelial tissue include the fact that they cover organs and body surfaces and hollow organs, have a free surface on one side and a basement membrane on the other side, usually lack blood vessels, they readily divide, they're tightly packed, and are classified according to either cell shape or the number of cell layers. The shapes can be either squamous, flat, cuboidal, cube-shaped, columnar, which are tall. The layers can be either simple, one layer of cells, stratified, more than one layer of cells. So here are the types of epithelial tissues. Simple squamous are single layer flat cells. Substances can permeate them easily. They line the air sacs, blood vessels, and lymphatic vessels. Simple cuboidal is a single layer of cube-shaped cells. They line the kidney tubules, they cover the ovaries, line ducts of some glands, and their function is to secrete and absorb. Then we have the simple columnar, single layer elongated cells. The nuclei are usually located near the basement. The membrane is at the same level. They sometimes possess cilia and sometimes possess microvilli. Often they have goblet cells that secrete mucus, and they line the uterus, stomach, and intestines. Pseudostratified columnar are a single layer of elongated cells. The nuclei are at two or more levels, which gives them the appearance of being stratified, even though they're not. They often have cilia, often have goblet cells, and they line the respiratory passageways. Then there's stratified squamous. These are many cell layers. The top cells are flat. They can accumulate keratin, so you'll find them on the outer layer of the skin. They also line the oral cavity, vagina, and anal canal. The stratified cuboidal have 2 to 3 layers of cube-shaped cells that line the ducts of mammary glands, sweat glands, salivary glands, and the pancreas. We also have another stratified columnar. That's the top layer of elongated cells. There's cube-shaped cells in the deeper layers, and they line parts of the male urethra and part of the pharynx. Transitional cells are many cell layers that are cube-shaped and elongated, and they can be stretched. They line the urinary bladder, ureters, and part of the urethra. On the other hand, glandular epithelium is composed of cells that are specialized to produce and secrete substances. And there are 2 types of secreting glands: endocrine that secrete into tissue, fluid, or blood directly, while exocrine glands secrete into ducts. A unicellular or one-cell exocrine gland is a goblet cell, while a multicellular exocrine gland is composed of many cells. You'll find those sweat glands and salivary glands, and they also can be simple and compound. And here are the structural types of exocrine glands: simple tubular, a simple branch tubular, a simple coiled tubular, or a simple branch alveolar. And then there's compound tubulars and compound alveolars. So let's talk about the glandular secretions. American glands are classified because they secrete a fluid product only. You'll find those salivary glands, pancreas glands, and sweat glands. Apocrine glands produce part of the cell, and they're found in the mammary glands and caramunous glands. Holocrine glands, on the other hand, secrete the entire cell. The entire cell breaks down and is secreted, and you'll find those in the sebaceous glands. So now we're done with that, we'll talk about connective tissues. General characteristics of connective tissues. They bind structures, they provide support and protection, serve as frameworks, fill spaces, store fat, produce blood cells, protect against infections, and help repair tissue damage. There's an extracellular matrix made of protein fibers and ground substance. They have varying degrees of vascularity or blood vessel supply. Their cells usually divide. The major cell types of connective tissue are the fibroblasts, which are a fixed cell. They're large and star-shaped. They produce fibers. Macrophages, which are wandering. They're phagocytic, and they're important in immunity and prevention of infection. And the mast cells. Those are fixed cells that release heparin and histamine. The connective tissue fibers. There's three types we're going to talk about right now. The collagenous are composed of collagen. They have great tensile strength. They're abundant in dense connective tissue. They hold structures together and appear white in abundance. Whereas elastic fibers are bundles of microfibrils embedded in elastin. They're very elastic and they appear yellow. Reticular fibers are very thin collagenous fibers, highly branched, and they form delicate supportive networks. We can also break the connective tissue down into groups. Connective tissue proper. There's loose connective tissue. There's three types. There's areolar, adipose, and reticular. There's specialized connective tissue, which is composed of cartilage, bone, or blood. And dense connective tissue, which is dense regular, dense irregular, or elastic. Let's talk about areolar connective tissue. Mostly fibroblasts. There's a gel-like ground substance, lots of collagen, lots of elastic fibers. It binds the skin to structures beneath most of the epithelia, and blood vessels nourish nearby epithelial cells. Adipose, on the other hand, the cells are called adipocytes. It cushions, insulates, stores fat. It's located beneath the skin, behind the eyeballs, around the kidneys and heart, and between muscles. Adipose is fat. The reticular connective tissue is composed of reticular fibers, supports the internal organ walls. You'll find it in the walls of the liver and the spleen. Dense regular connective tissue, closely packed collagenous fibers, elastic fibers, fibroblasts, very strong, binds body parts together, found in tendons, ligaments, and dermis. Has a poor blood supply, makes it slow to heal. Then we have dense irregular connective tissue, randomly organized, thick, interwoven with collagen, found in the dermis of the skin and around skeletal muscles. Elastic connective tissue, abundant in elastic fibers, some collagenous fibers, fibroblasts, forms attachments between bones, and is found in the walls of large arteries, the airways, and the heart. Now we move on to cartilage. I don't know why I said hyaline. A cartilage is a rigid matrix containing gel-like ground substance. The chondrocytes are in the lacunae. There's a poor blood supply. It's covered by perichondrium, and there's 3 types of cartilage: hyaline, elastic, and fibro. Hyaline is the most abundant. It's found on the ends of bones, found in your nose and respiratory passages, and it composes the embryonic skeleton. Elastic is flexible due to the elastic fibers. You'll find it in the external ear and the cartilage of the larynx. Fibrocartilage is very tough due to many collagenous fibers. It acts as a shock absorber, so you'll find it in the discs of the vertebrae and the pads of the knee and the pelvic girdle. So here's a slide of the 3 types of cartilage. And now we talk about bone. Bone, osseous tissue, a solid matrix. It supports the body, protects the organs, forms blood cells in the marrow. Attachment for muscles. It's the skeleton itself, and the osteocytes are in the lacunae. Blood. It has a fluid matrix called plasma. There are red blood cells, white blood cells, and platelets. It transports and defends. Now we talk about the types of membranes. There are 4 types of membranes. Serous, which lines the body cavities. So you'll find it in the inner lining of the thorax and abdomen. It covers the organs of the thorax and abdomen and secretes the serous fluid. The mucous membranes line the tubes and organs that open to the outside of the body. So you'll find it the lining of the digestive, respiratory, urinary, and reproductive tracts. It secretes mucus. Cutaneous membranes cover the body, so it's found in the skin. Synovial membranes is composed entirely of connective tissue and lines the joints. So let's talk about muscle tissue now. There's 3 types of muscle tissue: skeletal, smooth, and cardiac. They all have muscle fibers, and they're all contractile. They all contract. Skeletal is attached to bones. It's striated. It has stripes. Looks like it has stripes under a microscope. And it's voluntary. You move your muscles voluntarily. Smooth muscle tissue, on the other hand, is involuntary. You can find it in the walls of organs, in the skin, the walls of blood vessels, and it's non-striated. Cardiac muscle tissue is found only in the heart wall and other parts of the cardiovascular system. The heart wall mainly. It's involuntary. It's striated, and it has intercalated discs. Here's a slide of the muscle tissue. And you can see the striations. And you can see striations here. And there's some smooth muscles. And this is cardiac tissue. That's skeletal. This is smooth. And this is cardiac. Then we have nervous tissue, which is found in the brain, spinal cord, and peripheral nerves. Functional cells are neurons. Neuroglia support and bind nervous tissue components. Sensory reception takes place here, and there's also conduction of nerve impulses. Okay, so chapter 5 is over, and some of the points to know are how cells are organized into tissues, identify the intercellular junctions, list the 4 major tissue types, Describe the general characteristics and functions of epithelial tissue. Name the types of epithelium and identify an organ in which each is found. Explain how glands are classified. Describe the general characteristics of connective tissue. Compare and contrast the components, cells, fibers, and extracellular matrix in each type of connective tissue. Describe the major functions of each type of connective tissue. Describe and locate each of the 4 types of membranes. Distinguish among the 3 types of muscle tissue. And describe the general characteristics and functions of nervous tissue. That is the end of chapter 5. So now I'm going to go to chapter 6. And do a screen share for that. Well, let's see if this is sharing the screen. I hope it is. So chapter 6, we're talking about the integumentary system, or the skin. It's composed of several tissue types. The function of skin is to maintain homeostasis, provide a protective covering, retard water loss from our body, help regulate our body temperature. There's sensory receptors in our skin. We also have immune system cells. We synthesize chemicals, and we excrete small amounts of waste through our skin. The 3 layers are the epidermis, which is composed of stratified squamous epithelium. The inner layer, the dermis, which contains collagenous and elastic fibers. And a subcutaneous layer, the hypodermis, which is beneath the dermis, and is composed of areolar and adipose connective tissue. Now here's another look at the layers, the epidermis, the dermis, and the subcutaneous layer. And some of the different components. As you can see, a sweat gland there, a hair follicle over here, blood vessels, both venous and arterial. There's a sweat gland duct, a sebaceous gland. Let's talk about the epidermis first. It lacks blood vessels, it's keratinized, thickest on the palms and soles. Melanocytes provide melanin, which is a pigment. It rests on a basement membrane. It's composed of stratified squamous epithelium, and there are 5 layers to the epidermis. From the top, we have the stratum corneum, which is dead keratinized cells. The stratum lucidum is only in your thick skin, either the palms or the soles of the feet. Stratum granulosum, stratum spinosum, and stratum basilae, which is the mitotic layer, or where the cell division takes place. The melanocytes are located in the stratum basilae. They produce the dark pigment melanin. They also give the skin color and also helps absorb UV light. Heredity and environment determine your skin color. There are genetic factors, varying amounts of melanin, varying size of the melanin granules. Albinos lack melanin. There are environmental factors, sunlight, UV light from sun lamps, and X-rays all produce higher amounts of melanin. Physiological factors, dilation of dermal blood vessels, constriction of dermal blood vessels, and accumulation of keratin, jaundice, all will change the color of your skin. The dermis is a layer underneath. It's either between 1 to 2 millimeters thick, contains the dermal papillae, binds the epidermis to underlying tissues. It's composed of dense, irregular connective tissue, muscle cells, nerve cell processes. There are specialized sensory receptors. There are blood vessels, there are hair follicles, and there are glands. There are actually two layers to the dermis. The papillary layer, it's areolar, thin, superficial, and that's where the dermal papillae are there. The reticular layer is dense, irregular connective tissue, and it composes most of the dermis. Some of the accessories structures of the skin originate from the epidermis, and they include your nails, your hair follicles, and your skin glands. And there's a shot of your nails, the three parts. The hair follicles, including the root, the bulb, and the hair shaft. There's also an erector pili muscle, located right there. Sebaceous glands, they're usually associated with the hair follicles. They're Hollican glands. They secrete sebum, which is fatty material and cellular debris. They're not present on your palms or soles. You don't have any sebaceous glands on the palms of your hand or the soles of your feet. Sweat glands, they're also called sudoriferous glands. They're widespread in the skin. They originate in the deeper dermis or hypodermis. They're eccrine, they're apocrine for scent, ceremonous, and mammary glands. Okay, let's talk about regulation of body temperature. It's vitally important because even slight shifts in your body temperature can disrupt rates of metabolic reactions. Skin also plays a key role in the homeostatic mechanism that regulates the body temperature. So heat is a production of cellular metabolism. The most active body cells are the heat producers, and they include skeletal muscle, cardiac muscle, cells of certain glands such as the liver. Primary means of heat loss is radiation, or it radiates out of your body and into the air, and also conduction, convection, and evaporation. This is a shot a little bit of the set point of your body and the stimulus that the body rises above normal. The thermoreceptors send signals to the control center. The hypothalamus detects the deviation from the set point and signals the effector organs. And then dermal blood vessels dilate and sweat glands secrete. So the response is body heat is lost to surroundings and temperature drops towards normal. If the opposite occurs and your body gets cold, then your body will, the effector dermal blood vessels will constrict, sweat glands will remain inactive, and also the muscles will contract involuntarily in a process called shivering. So there's a couple problems in temperature regulation. If there's hypothermia, which is a normal high body temperature, or hypo, which is a normal low body temperature. Okay, we're talking about healing of wounds and burns. Inflammation is a normal response to injury or stress. Blood vessels and infected tissues dilate and become more permeable, allowing fluids to leak into damaged tissues. The inflamed skin becomes reddened, swollen, warm, and painful. And we're talking about the cuts here. Shallow cuts results in epidermal cells along its margin divide more rapidly than usual. And deeper cut will result in blood vessels breaking, which causes a clot to form. Then the clot and dried tissue fluid form a scab. Growth factors stimulate new tissue formation. Phagocytic cells will remove the dead cells and debris. And if you have excess collagenous fibers, they might form a scar. A little bit here on the process of healing. First we get an injury, and the blood vessels are broken, the blood clots, the scab forms, eventually new skin is formed underneath, and the scab dries up and rubs off. And then we have first-degree burns, which we did not cover. Lifespan changes. Skin becomes scaly, age spots appear, epidermis thins, dermis becomes reduced, you lose fat, you start to wrinkle, everything sags, and the sebaceous glands secrete less oil. Melanin production slows, the hair thins, number of hair follicles decrease, nail growth becomes impaired, sensory receptors decline, body temperature is unable to be controlled, and you have a diminished ability to activate vitamin D. Those are all signs of aging. Okay, so let's talk about what outcomes need to be assessed for this chapter. We have to be able to describe what constitutes an organ and name the large organ of the integumentary system. Discuss the functions of that large organ. Describe the structure of the layers of the skin. Summarize the factors that determine skin color. Describe the accessory structures associated with the skin. Explain the functions of each accessory structure. Explain how the skin helps regulate body temperature. Describe the events that are part of wound healing. Describe wound healing. Distinguish among the types of burns, including a description of healing with each type. And summarize the lifespan changes in the integumentary system. So that's it for chapter 6. We're going to get on to chapter 7. Okay, I need to get chapter 7 up here. I hope this is working. And now I have chapter 7 up anyways. Maybe I didn't have chapter 6. All right then, chapter 7 on the skeleton, the skeletal system. Initially, the skeleton is cartilage and fibrous membranes. That's the embryonic skeleton. Hyaline cartilage is the most abundant of the cartilage. By age 25, though, the skeleton is completely hardened. There's 206 bones that make up the adult skeleton. They take up 20% of the body mass. There's 80 bones of the axial skeleton and 126 bones of the appendicular skeleton. Bones are the organs of the skeletal system and are composed of many tissues, including bone tissue, cartilage, dense connective tissue, blood, and nervous tissue. The functions of bones include supporting and protecting softer tissues, providing points of attachment for muscles, housing blood-producing cells, and storing inorganic salts. Bones can be classified by shape. We have the long bones, the short bones, including sesamoid bones, the flat bones, and the irregular bones. Bones of the skeletal system vary greatly in size and shape. There is a similarity in structure and development and function. The parts of the bone. This is a long bone. Includes the epiphysis, the distal and proximal. This is the proximal and this is the distal. The diaphysis, which is basically the shaft of the bone. The metaphysis, the compact bone and the spongy bone. Compact is cortical bone. A spongy bone is called cancellous bone. There's articular cartilage covering the bone ends. There's a periosteum that's underneath that cartilage, and that's the outermost layer of the bone. The endosteum lines the inner portion of the compact bone. Then there's a medullary cavity that contains the marrow and the blood vessels. There's tubercula, which are needle-like projections in the cancellous or spongy bone. The bone marrow is either red or yellow, depending on location and the age of the bone. Mature bone cells are called osteocytes. Osteocytes transport nutrients and waste. There's an extracellular matrix around the bone cells that's largely collagen and inorganic salts. The collagen gives bone resilience, and the inorganic salts make bone hard. Here's a cutout of a compact bone. The osteon, that's a Haversian system. It's circular. It has a central canal running through it, a perforating canal, and a Volkmann's canal, called Volkmann's canal. The osteocytes are right there. There is lacunae. Those are spaces. There's canaculus or caniculi. Those are transporting waste and nutrients between the bone cells. And the matrix itself, that's again collagen and ground substance. So that's a look at the compact bone. Spongy bone, the extracellular matrix is laid down in the tubercula. The osteocytes reside in lacunae within the tubercula, and there's also caniculi. Bone development and growth. Parts of the skeletal system begin to develop during the first few weeks of prenatal development. Bones form when bone tissue replaces existing connective tissue in one of two ways. It either becomes intramembranous bones, parts of the skull, or endochondral bones, long bones of the body. So these bones originate within sheet-like layers of connective tissue, the intramembranous bones. They're broad and flat. Like I said, the flat bones of the skull, the clavicles, the sternum, and some of the facial bones. Osteoblasts are the bone-forming cells. The endochondral bones begin as hyaline cartilage. They form models for future bones, and they're most of the bones of the rest of the skeleton. We have the endochondral ossification. We start with a cartilaginous model. Periosteum develops around it. Some of the cartilage gets calcified. Some of the compact bone starts developing. Blood vessels form. The ossification center is in the center of the bone. You get more ossification going on the outside in the spongy bone area. As the bone grows, epiphyseal plates form to allow for further growth. And eventually, the bone develops fully. The remnants of the epiphyseal plates are called epiphyseal lines, and it's a fully developed bone. Now, I don't think we talked much about growth at epiphyseal plate. There's a zone of resting cartilage, a zone where the cartilage proliferates, a zone where the cartilage grows bigger than normal, and a zone where the cartilage calcifies. And underneath that is the ossified bone of the diaphysis. So there's lots of rows of young cells in the proliferating cartilage. They're all undergoing mitosis. In the third layer, these are older cells. They're left behind when the new cells appear. These cells enlarge and become calcified. And then the zone of calcified cartilage is the fourth layer of cells. They're thin, they're dead, they're calcified, and with lots of extracellular matrix surrounding them. So bone tissue also has to maintain homeostasis, and bone remodeling occurs throughout life. First, the osteoclasts, they break down and resorb bone. The osteoblast deposits new bone, and so 10 to 20% of the skeleton is replaced each year. So let's talk about some of the factors affecting bone development, growth, and repair. If you have a deficiency of vitamin A, that will retard bone development. Deficiency of vitamin C can result in fragile bones. Vitamin D deficiency can cause rickets and osteomalacia, or softening of the bones. Insufficient growth hormone can cause dwarfism. Excessive growth hormone can cause giantism and acromegaly. Insufficient thyroid hormone will delay bone growth. And sex hormones promote bone formation and stimulate ossification of epiphyseal plates. Physical stress or exercise can stimulate bone growth. Bone function. Bones shape, support, and protect body structures. They give shape to the head, support the body's weight, protect the lungs, and bones and muscles interact when limbs or body parts move. There's also blood cell formation, also known as hematopoiesis, that occurs in the red bone marrow. There's also inorganic salt storage. The most abundant salt being stored is calcium phosphate. Other salts stored are magnesium ions, sodium ions, potassium ions, and carbonate ions. Osteoporosis is a condition that results from the loss of bone mineral. And let's talk about the skeletal organization. As we talked about before, there are typically 206 bones in the human skeleton. The actual number can vary from person to person. And here's a look at the axial skeleton, the skull, the hyoid bone, and the thoracic cage. Then we have the appendicular, the pectoral girdle, the upper limbs, the pelvic girdle, and the lower limbs. And now we have the skull, the cranium, and the facial bones. We should at least know some of the bones of the skull in this class. Most of it will be learned in lab. And you can see the frontal bone, the temporal, the parietal. And here's the back of the skull with the base of the cranium, the foramen magnum, the vomer. Everybody should know where the vomer is. And here's the cranium again. And a look from underneath. And here's some of the bones in the facial skeleton. And more of the facial skeleton. I'm not going to go through all these because you learn these in your lab. Should know that there are fontanelles. Eventually everything closes up and forms sutures. There's a vertebral column coming out of the skull. It's separated by cartilaginous intervertebral discs. And you should know the number of vertebrae. And starting from the cervical all the way to the coccygeal. And the curvatures, the cervical, the thoracic, the lumbar, and the sacral. The typical vertebrae and the parts. Again, this is something that will be in your lab. The atlas that supports the head. The axis is the second, the cervical vertebrae. The atlas pivots around the dens, so you can turn your head. And looking at the thoracic, the shape, the difference in shape from the thoracic and lumbar and the sacrum and the coccyx. And there's the thoracic cage itself. And the ribs themselves, they have 12 pairs of ribs, 7 are true. There's 5 false ribs, of which 2 are floating. And there can be some anomalies, cervical ribs and lumbar ribs. And there's a rib structure. There's a look at the sternum, manubrium, body, and xiphoid process. And we're just going through the different bones of the body, so I really don't want to get into this because chapter 8 is coming up. But all this is all lab material. Okay, lifespan changes though. People start shrinking once they reach about age 30. The calcium levels in your blood fall. Bones become brittle. Osteoclasts start outnumbering osteoblasts. Spongy bone weakens before compact bone. Bone loss is rapid in menopausal women. Hip fractures start becoming common as they get very old. Vertebral compression fractures can be common. Okay, so the outcomes to be assessed. We have to discuss the active tissues found in a bone, list the general functions of the skeletal system, classify bones according to their shapes, and name an example from each group. Example, a long bone, a flat bone, a short bone, and a regular bone. We should be able to name a bone example of each group. Bone structure. Describe the macroscopic and microscopic structure of a long bone and list the functions of these parts. Bone growth and development. Distinguish between intramembranous and endochondral bones and explain how such bones develop and grow. Describe the effects of sunlight, nutrition, hormonal secretions, and exercise on bone development and growth. Discuss the major functions of the bone. Skeleton organization. Distinguish between the axial and appendicular skeletons and name the major parts of each. And the skull, lower limbs, and describe lifespan changes in the skeletal system. So that's it for chapter 7. Okay, I'm going to pull up the screen share for the PowerPoint for chapter 8. Let's see if we can do a screen share for that. If this is working. I'm getting this right. Okay, let's get the screen share going. I think I got it this time. I thought I did. Okay, here, I just had it. Oh, right, what's going on with this thing? Let's see. Oh, there it is. Okay, chapter 8. We're talking about articulations, or the bones coming together and they form a functional junction, and that's called a joint. These articulations make bone growth possible. They bind parts of the skeletal system together. They permit parts of the skeleton to change shape during childbirth, and they enable the body to move in response to skeletal muscle contraction. 3 classifications of joints will be considered. Structural classification. We can have fibrous joints, which are just dense connective tissues connecting bones. The bones are in close contact. Cartilaginous joints. Hyaline cartilage or fibrocartilage connects bones. Synovial joints. They're the most complex and they allow for free movement. There's also functional classification of joints. They can be synarthrotic, which are considered immovable. They can be amphiarthrotic. They can be slightly movable. Or they can be diarthrotic. They can be freely movable. Fibrous joints, there are 3 types, or synarthrosis. There's a syndesmosis, a suture, and a gomphosis. The syndesmosis is a sheet of, or bundle of fibrous sheet tissue connecting bones. For example, the tib and the fib, or tibia fibula, are connected by a syndesmosis. This is called an interosseous membrane of the leg. It's amphiarthrotic. So that would mean it's slightly movable, but not much. Then we have a suture. These are located between flat bones. They have teeth-like projections. There's a thin layer of connective tissue between the bones. Located in the skull. They're synarthritic, so they're not movable at all. And the gomphosis is another example. It's a cone-shaped bony process in the socket. For an example, the tooth in the jawbone. And it's also synarthritic. We also have cartilaginous joints. There's 2 types: synchondrosis and symphysis. A synchondrosis is bands of hyaline cartilage uniting bones, the epiphyseal plate, which is temporary, or the manubrium between, well, they're located between the manubrium and the first rib, the costal cartilage. So the rib's not exactly connected to the manubrium of the sternum, but there's cartilage that connects it. And then you have the symphysis. That's the pad of fibrocartilage between bones. For example, the fibrocartilage between each vertebrae. And also the fibrocartilage disc of the symphysis pubis. Synovial joints. Most joints are synovial joints. They're all diarthritic or freely moving. They consist of articular cartilage, a joint capsule, and synovial membrane, which secretes synovial fluid. And looking at the general structure of a synovial joint, you'll see that there's articular cartilage surrounding the bone. There's a joint cavity filled with synovial fluid. That is surrounded by a joint capsule itself. And 2 types are the meniscus in the knee and also the bursa. You find a bursa in the shoulder. The types of synovial joints. Ball and socket. You find these in the hip and shoulder. Condylar or ellipsoidal joint between the metacarpals and the phalanges, between the radius and the carpals. And there's also the plane or gliding joints between your carpals, between the tarsals, and between the facets of the adjacent vertebrae. You also have hinge joints, like an elbow joint, or between your phalanges. And we have a pivot or trochoid joints between the atlas C1 and the dens of the axis C2. The atlas rotates on the dens. And there's also the saddle or cellar joint between the carpal and the first metacarpal of the thumb. Okay, let's talk about the types of joint movements. Movement in a joint occurs when a muscle contracts and its fibers pull its movable end or insertion towards its fixed end or origin. And let's talk about some of the types of movement. Abduction, moving away from the midline. Adduction, moving toward the midline. Dorsiflexion, flexing your foot upward, or plantar flexion, flexing it downward. Then you have flexion, extension, and hyperextension. Flexion is your bending your knee. Extension is your raising that knee. Hyperextension means that the bottom part of your lower leg would go past 180 degrees and forward past the knee, would go forward. There's also lateral flexion. You can flex laterally. And then we have rotation. That's turning horizontal towards the middle, or lateral, turning horizontal toward the outside. Circumduction is going in a circle. Supination is turning the hand up with the palm facing up, or turning it over with the palm facing down. And then we have eversion and inversion. You can invert your foot towards the midline by turning your ankle on your ankle, and evert the same way to the outside. Rotation is moving your head forward, and retraction is bringing it back. Elevation is bringing your shoulders up, and depression is bringing your shoulders down. So let's look at examples of the synovial joints. The shoulder, elbow, hip, and knee are large, and they're freely movable joints. And here's a shoulder joint with the ball and socket. The head of the humerus articulates with the scapula, the glenoid cavity. Okay. There is a joint capsule. There's a joint cavity. And you have a very wide range of movement there. Mostly circumduction, but you can elevate, you can flex. There's lots of things you can do with the shoulder joint. Another picture of it. Again, the elbow, it's a hinge joint, a plane and gliding joint. There's many reinforcing ligaments in the elbow. Another picture of some of the ligaments. You can see the connective tissue between the radius and the ulna. There's the hip joint. It's also a ball and socket joint, with the head of the femur articulates with the acetabulum of the hip bone. It's a heavy joint capsule. There's many reinforcing ligaments, and it's a variety of movement, yet less than at a shoulder joint. Another picture of that. Knee joint, most complex, because you have you have the knee joint and the tibia coming together, and the patella is also there. There's menisci, there's a bursa, the joint capsule, there's synovial membrane, there's all sorts of tendons, and there's ligaments on each side and then behind. There's anterior cruciate. There's there's lateral ligaments, collateral ligaments of the tibia. There's a fibular collateral ligament. There's some popliteal ligaments. There's a patellar ligament, posterior cruciate ligament. So there's all sorts of ligaments involved. So let's talk about lifespan changes, and we're going to be going over the points to know. Joint stiffness is an early sign of aging. Fibrous joints are the first to change, can strengthen, however, over a lifetime. Changes in symphysis joints of vertebral column diminish flexibility and decrease the height. Synovial joints lose elasticity. Disuse hampers the blood supply. Exercise and activity can keep joints functional longer. Okay, so we need to list the function of joints, explain how joints can be classified according to the type of tissue that binds the joints bones together, and the degree of movement possible of the joint. We have fibrous joints, so describe how bones of the fibrous joints are held together and name an example of each type of fibrous joint. Cartilaginous joints, describe how those bones are held together by the joint and name an example of each type of cartilaginous joint. Synovial joints, describe the general structure of a synovial joint, distinguish among the 6 types of synovial joints, and name an example of each type. And then explain how skeletal muscles produce movement in joints and identify several types of joint movements. So abduction, adduction, inversion, eversion, flexion, extension, hyperflexion. Describe the shoulder joint and explain how its articulating parts are held together. Describe the elbow, hip, and knee joints and explain how their articulating parts are held together. And describe the lifespan changes in joints. And that's it for this review. I hope all the PowerPoints came out. I'm not sure about one of the chapters, but let's hope they did. Anyways, good luck with your tests next week. I know next week is the week for the test. And then I'll be back in 2 weeks for chapter 9, 10, and 4A. And then 2 weeks after that, we'll have a final exam review. So good luck, have a great weekend, and stay warm.